Did you know that 40% of lives are saved from mammograms for women diagnosed with breast cancer in their 40s or younger? In today's Focus on Your Health, Dr. Susan Hoover from Moffitt Cancer Center joins us to explain further how important it is to get screened. Good morning, doctor. How are you?
I'm fine, thank you.
You know, really glad you are here because obviously this is a very important message. And like you and I were just talking in the break, you were saying how there's some uncertainty that women are maybe questioning if once they hit 40, if they really need to do it or not. So tell us about the controversy a little bit and why we should kind of ignore it.
So internationally, there really has, over the years, always it resurges that really should we be screening women at the age of 40. And I think the bottom line for those of us that deal with breast cancer and breast disease, 40 is the prime age to get mammogram every year.
What is it about 40? I know this is kind of like an off-topic question. Say a woman's, 35 and she has it in her family. Is that still the time to, even though they haven't hit that 40-year mark? What would you recommend?
Yeah, there's some complex recommendations in that regard, but in general, I would, if someone has a family history, talk with your healthcare provider to see when exactly that screening should occur. But in terms of the age of 40, we find that breast cancer does not discriminate. So it can affect women of all ages, and as a matter of fact, it's the most common cancer in women, and it affects 1 in 8 women.
How important is it to get that early diagnosis that a mammogram can provide?
Very important. So data has shown over and over again that early detection saves lives, and we've reduced the mortality or the death rate from breast cancer from women just getting screening mammography.
And I know you are always up to date on the latest technology and the latest treatment, and it sounds like you have a ton going on there at the Moffitt Cancer Center. Kind of break down what you're able to do right now with breast cancer patients.
So Moffitt Cancer Center, of course, offers state-of-the-art technology in screening women for breast cancer. So we offer 3D mammography, and although the mammogram is done exactly the same way as traditional mammography, what's different about it is it takes several slices through the breast in terms of pictures, and it helps us to not only detect cancer better, but also decreases the screening callback rate, meaning when you have a mammogram and something's abnormal, we have to call people back for more imaging, women have to take off work and that sort of thing. So it has really improved our detection rate and decreased our callback rate. And then just in addition, we also have probably one of the few in the state is a whole breast screening ultrasound, and it's great in terms of for women with dense breasts, and it helps us also to find things a lot more easily.
Because I think sometimes women do get that call back, and obviously that's scary, and then they have to go back. That those are some of the reasons that you see people putting it off and maybe thinking, oh, I don't need to get it every year.
Yeah, it's still very important to get it every year. And I think the key is don't be afraid. The earlier that we find it, we really can help people. And even if they have cancer, we cure breast cancers. So I think it's very important that people keep in mind that early detection is key.
And even the early detection, I know in the future there's other exciting things that you're working on in hopes of maybe, I don't even want to call it early detection, but possibly a vaccine?
Yeah, in terms of treatment, Moffitt is an NCI designated cancer center, and we're the only one in the state of Florida. So what comes with that is a lot of researchers and research that's getting done, and in particular, we are one of the few nationally that's looking at vaccines for certain types of breast cancers to help those patients to fight their own cancers.
And I'm just curious if people are watching at home and maybe they're obviously hit the 40 and they're after menopause and they're, getting into their elder years. There's no max age, right?
Nope. I mean, in Florida, we see our patients are so healthy, even into their 70s, 80s, and even 90s. I don't think there's really any cutoff for mammography. It's really important to get it done.
Okay, again, thank you for coming on and stressing the importance of getting those mammograms.
Thank you for having me.
Thank you so much for your time. And to schedule a breast screening appointment, give Moffitt Cancer Center a call or visit their website or even their Facebook page, which is all on your screen.